So you already know that GI system, there are some cells, there are some gastric peats, and one of the important thing is that the HCl, that is means hydrochloric acid. It's critically very important because we know that you came across with some patients with severe abdominal pain, heartburn, dyspepsia, as well as problem with the swallowing problems. So there is a GI problems. Most of the cases is ulcer is very prominent nowadays. So most important cause of peptic ulcer disease is hypersecretion of HCl, and HCl is secreted from parietal cells. There are some cells are there in the gastric pits. What are those? G cells, surface epithelial cell, neck cells, peptic cells, then G cells, right? Others? Chief cells or peptic cells is same. Oxyntic cell and parietic cell is same. Then any other? Enterochromaffin cells, very good. Then any other cells? G cells already explained. Zymogen is not a cell, it is a granules. It is present in the peptic cells as a zymogens, there is a pepsinogens is present. Mast cells not present because mast cell is present mainly in your skin. Mast cells releases the histamine. That's why the itching happens. Yes? Serotonin is actually released from the enterochromaffin cells. That is very important. Not in this class because enterochromaffin cells is ECL present in our gastric pits and releases only two things, that is histamine and another is serotonin. There is another clinical importance in that. There are some cells are there, so as probably I missed because you don't say that. There is a stem cells. Why it is important? Because already you know that we are day-to-day eating habits and lots of toxins are going inside our stomach, and then there are some micro injury happening into our gastric mucosa. Regular damage is happening. Suppose this is our stomach, then there is a damage of this cell, this part will may damage regularly. We are taking some foods, you are taking so much spicy food, all three is happening due to the damage. But do you expect the damage will be permanent? No. So if it is damaged, then must be some repair. Before repair, there must be some stem cell to regenerate, right? So that stem cell present into our gastric pits. There are some cells right there, you know already. So in this same time, some sorts of stem cells are present here and there, right? Sometimes when it is damaged, this portion is damaged, then these cells come up. These cells come up as a stem cell for the formation of the another new cells. New cells mean surface epithelial cells, etc. And that is called this migration of the cells, migration of the stem, not only stem cell, migration of the some neck cells also to reproduce the cells or help to maintain the barrier is called restitution. Is very important for pathophysiology of peptic ulcer, right? Restitutions means migration of healthy cells into the surface area for the process of healing faster, for the fasting process of the regenerations of the cells. You know that regeneration means there must be some stem cell. What is that? Stem cells. Whatever is blood, etc., is growing in our bone marrow is from our stem cell. So that kind of stem cells is present also in the gastric pit, right? So that every day this is damaging, every day and every hour. But do you expect that if it is damaged, suppose this parietal cell is damaged, then why will come as an intrinsic factor and HCl? That will also not come out for our digestion system, and that's a hamper. But not like that. Our physiology system is like that there is some stem cells as well as some healthy neck cells or surface epithelial cell that come into the damaged area, that means migration, and that is called restitution, and that is energy dependent. That is also energy dependent. That needs some energy, and that is coming from our ATP. I am not going details into restitutions. It is a huge thing, and in case of gastro physiology or gastromedicine, this is a huge topic. That you can say that restitution is 1 or 2 books are there, right? So only this term may have some 2 to 3 books are there. I have written only the half books of 1 book, right? So that is not possible, and that's not important for this domain to understand. But at this moment, you are being able to be a doctor, so you must understand the term. The restitution is related to your peptic ulcer disease. If restitution is fails, then peptic ulcer disease will take upper hand, because that only if the damage is not repaired, then only our hypersecretion of HCl can damage more further to the others layer. What are the layers of the stomach? Anyone? Not serosa is from outside. You take always from inside. Mucosa, submucosa, and ultimately serosa, right? If it is ulcer that can damage mucosa, to damage korbe and will enter into the submucosa, and it can damage layer by layer, and that can cause perforation also. So in surgical department, you came across during intensive that severe abdominal pain, and pain is your abdomen is very hard. Pain is a patakatar modo shotpot korchi. Severe pain is there. When a chest X-ray done, that is some specific signs are there, and you identify that patient is having some joint pains, and he is taking NSAIDs, that is non-steroidal anti-inflammatory drug, that is painkiller. He is taking for long duration time, and now he or she is presented as a severe gastric perforations after the ulceration. So before that, if you miss the ulcer, then that patient may landed into perforation and danger. So now this is the restitution related to your peptic ulcer disease, and our HCl is a main culprit. Hypersecretion of the culprit main things is causing the peptic ulcer disease. But now question is that is HCl is helpful for us? Yes, definitely it is helpful. I am coming later with what is the functions of HCl. But before that, probably I not completed the total how HCl is formed. How HCl is formed from the parietal cells? Anyone? Hey, duster to change kora jabe go. So you know already that parietal cells having intracellular canalicular, right? There is also some tubulofascicles, so that these tubulofascicles connected to the intercanalicular to increase the surface area, so that the release of HCl becomes easier. So if I draw a parietal cells like you can say like that, and this focus as a parietal cells are there. So these are your intercanaliculi, that is coalesces with your tubulofascicles part. This is your apical part. I am taking this lumen. Lumen means what? Gastric lumen. This is lumen. So this one is lumen, and this here is a blood vessel. This is a blood vessel, right? And now between the cell, in your general physiology, between the cell and the blood vessel, it is called interstitial space. It is your blood vessel. It is your parietal cell, right? This is area is your interstitial space. Remember always, this will happen. Any cell having blood supply, there must be some interstitial space, and that space is here. Now, how is HCl ekhane aste hobe? That means what? H plus ion aste hobe as well as Cl minus aste hobe. How it comes out, right? Remember, it only from this class. Etake mukhosto korar kono kichu dorkar nei. In any cell, you know, ami etai muche dilam ekhon, you know that these cells having some internal metabolism, right? During the metabolism, in your biochemistry, you will say that carbon dioxide will reappear. Not only that, in the blood, from blood, that may diffuse is a carbon dioxide. Water is present in the cell, and with the presence of carbonic anhydrase, it will form as a H2CO3. It is unstable, so form H plus and HCO3 minus. এইটুকু বোঝা গেছে? তাহলে আলটিমেটলি কি তৈরি হলো আমাদের এখানে? আমি এবারে রিঅ্যাকশনটা মুছে দিলাম। রিঅ্যাকশনটা মুছে দিয়ে আমি লিখলাম যে আমার H প্লাস আসছে আর একটা HCO3 মাইনাস, রাইট? সো একটা পজিটিভ একটা মাইনাস আমার এই সেলটা this HCl is important for this one to come, right? So there should be some pump that is called hydrogen potassium ATPase pump, needs energy, right? That is called proton pump also, and this way this H plus will come, and in the lumen there is some lots of potassium are there, and that will go into the cell. বোঝা গেল? আসছি, তারপর পটাশিয়ামের কি হবে আসছি। নাও ক্লোরিন আসতে হবে, শুধু তাই না বাইকার্বনেটকে কোথাও একটা যেতে হবে, right? So bicarbonate will come out by using bicarbonate chloride antiprotar means একদিকে যাবে আর অন্যদিকে আরেকজন যাবে। So bicarbonate will come out from CO3 and this chlorine is coming from cell, that is vascular to the interstitial space, and then chlorine minus is coming out. So now chlorine is inside the cell, bicarbonate is outside the cell, and bicarbonate it diffuses into your blood. So blood এ আমার কি হলো bicarbonate চলে গেল, and these things will happen regularly. তাহলে কি হবে এখানে bicarbonate বাড়তে থাকবে, তাই তো? এখানে bicarbonate বাড়তে থাকবে ব্লাডে, HCO3 বাড়ছে। So now this will happen as a alkaline form of this blood, and that is called টার্মটা আসছে না এখনো, বল। Alkaline tide. So that is called alkaline tide. It may come as a short note. That is called alkaline tide. Now remember two things, that not only your pH of the blood vessels will increase, pH of the urine also increase, right? So during this alkaline tide, not only the pH of the blood is increased, pH of the urine also increase. So that is a point that make ask in exam, যে alkaline tide কি কি হয়। Your question should be like that, answer should be like that. যে sir, whenever you are giving any viva exam or giving answer, so take your time and kill your time in front of your examiner. Whatever you know, stock within yourself, right? So if any examiner asks you that after the alkaline tide you are saying that, what will happen? So your answer will be like that, sir, pH of the blood will increase, just stop. If examiner say আর কি হয়, so you are taking questions whichever you are known to you, right? So you have to answer, sir, urine pH increase হয়। তাহলে তুই যদি ফার্স্টে বলে দিস স্যার ইউরিনও ইনক্রিজ হয়, পিএইচও ইনক্রিজ হয়, তাহলে তুই কোশ্চেনটা ইনক্রিজ করলি না, মার্কসটাও তোর কিন্তু কমতে থাকলো। So that is a tactics, not only for your first year professional MBBS, it is all through our MBBS, it is important. So kill the time in front of your examiner in brilliant way, right? Whatever you know, you can take him or herself for examiner that in your directions. এমন কোনো টার্ম উচ্চারণ করা যাবে না যেটা তোদের দাদাদিরা এবারেও দেখলাম করছিল, জানে না যেটা সেটা উচ্চারণ করছে। তো whenever we will finish any word that is not is known to you, don't utter the term, right? That will be detrimental for your marks. Anyway, so this is coming and the chlorine is coming from blood into the cell. Now this cell have to come here, right? So how it is coming? This is the chloride channels are there, only chloride channels, simple chloride ion channels are there, and they come out as a Cl minus, right? Now one important thing is potassium. Now in a practical sense, whenever you are suffering from any vomiting, right, any problems happening, is dyspepsia, any sorts of food was bad smell is coming out, anything, and that can happen, hyperacidity, that can cause your vomit. You're vomiting in your suppose in your hostel or in your home, and 1 to 2 times happens. Now problem is that after vomiting you will feel that some weakness happening in throughout our limbs because of this potassium. So lots of potassium will be loose during the vomiting because lots of potassium is present in the gastric juices. So this potassium is recycling like that. This potassium is coming here into through this pump, that is hydrogen potassium ATPase pump is coming into the cell, but it does not remain into the cell because the potassium can come out again through a potassium channel and came again into your lumen, and this is your cycle. বোঝা যাচ্ছে? So the luminal K plus ion remains unchanged. So that's why if vomiting happens, the huge amount of potassium will come out, and you may suffer from your lose your potassium. And potassium is important not only for your neuromuscular junctions, it is important for your cardiac cells, and the tissues are there. You will learn how potassium is helpful. Hypokalemia is not a good thing. Potassium level serum 3.5 to 5.5 milliequivalent per liter is important. Whenever we see any patients with lots of vomiting and diarrhea, always we do for examination, that is sodium and your potassium. Potassium correction is important because potassium is in not only your GI tract, also present throughout the GI tract, and also if potassium is less, it happens for your kidney problems also will be there. Another entity. So what you will learn from this, the parietal cells having some intracanalicula surface area increase, and also some potassium, sodium, hydrogen potassium pump is there. That is called proton pump. Why am come the proton pump? You know already half of the students have taken some pantoprazole, azoles, right? Pantoprazole, omeprazole, lansoprazole, esomeprazole. So these prazoles are act as a proton pump inhibitor. রাইট, বাবা মারা শিখিয়ে দিয়েছে না, যদি দেখিস যে পেটটা একটু গন্ডগোল করছে একটা করে প্যান40 খেয়ে নিবি, তাই তো? কে বলেছে? কাকা মা বাবা বলেছে, দেখ পাঠিয়েও দিয়েছে। সো ইউ আর টেকিং দ্য প্যান40 or anything and it is the pantoprazole. Why it acts? Its acts is a proton, directly proton pump inhibitor is that. So directly is a proton pump inhibitor that, right? But যারা খাচ্ছিস, remember that if it is more than 2 months you are taking and suddenly you are stopped, then what will happen? I'm coming. What will happen in your clinical practices? So proton pump inhibitor acts here, right? Now this HCL secretions is happening regularly, and gastric juices or gastric you can say secretion happens per day, that is 2 to 2.5 liter. বোঝা যাচ্ছে? ডেলি আমাদের শরীর থেকে আমাদের স্টমাকে 2 to 2.5, হ্যাঁ, কোনো ভালো বইতে 2 লেখা আছে, কোনো বইতে 2.5 লেখা আছে, তাই 2 to 2.5 liter of gastric secretions happens per day in our body. So now this huge amount of this one, and not only that, this H plus is very strong and remains this pH is 1.8, 1.5 etc. in the lumen. But in the vicinity of this one, এটা lumen একটা, right? এটা the gastric pits, the lumen আছে এখানে. So these are your mucus layer is there. Mucus, not only mucus, also bicarbonate. Because next cells releases the bicarbonate. Not only bicarbonate coming from the directly cells, because these cells also supply it into the blood. তাই তো? এই যে ব্লাডটা, এই যে ব্লাড ভেসেল তো এখানেও আছে, একেও তো সাপ্লাই করছে. This is also supplied because this is your parietal cell, and parietal cell present where? Gastric pits. In the gastric pits, your parietal cells is present. But remember, your parietal cell present only in the corpus or body part of the stomach, not in your antrum part. Because already know the cardia, right? Cardia part, and then corpus or the body, fundus, antrum, pylorus, right? From the antrum, you know already that these G cells are there. Another G cells are there, that is your upper part of duodenum. That is a G34, and that is a G17. Also there is another part is there, that is a G14. So আজকের ডেটে G14, 17 and 34, there are 3 types of gastrins are there. I'm coming. But most important is our 17. So G7, if it MCQ it comes like that, which gastrin helps for our gastric secretion maximally? G14, G34, G17, all of these. So answer will be like G17. Anyway, so that is your alkaline tide, and that helps to increase the pH of the urine as well as blood. That is our entity. So আমরা যত খাচ্ছি, তাহলে এই কোশ্চেনটা ঘুরিয়ে আসতে পারে এইভাবে, when you are taking any food after 1 to 2 hours, what will be the conditions of your urine pH and why? বোঝা যাচ্ছে কিভাবে অ্যান্সার মানে এটা হবে? After taking food half an hour or 1 hour, after a few hours, then what will be our urine pH after taking? This pH will be high. And why? Why এর কারণ এখান থেকে আসবে, বোঝা যাচ্ছে? সো দ্যাট ইজ টার্মটা কি থাকবে? অ্যালকালাইন টাইড। তো যখন আমরা খাতা দেখব তখন আমি খুঁজবো তুই কোথায় লিখেছিস অ্যালকালাইন টাইড। যে লিখেছিস 3 এ 3, 4 এ 4, বোঝা যাচ্ছে? এইভাবে খাতা দেখা হয়। So in this pattern, this is very important for this alkaline tide and this one. But remember, this PPI is not a good drug at all for the long term. I will tell if time permits. I will say that why, if it is taking of the 2 months, then why it is a rebound hypersecretion of acid happens. Why rebound hypersecretion of acid happens? তুই 2 মাস ধরে পিপিআই খেয়ে আছিস, খুব ভালো আছিস, সাডেনলি তোর মা বা কেউ একটা বললো যে আরে এটা খাস না, আর খেতে হবে না, তুই তো ঠিকই আছিস। So you stopped without knowing the proper physiology of this one and how it acts. Then rebound hypersecretion happen and that can cause your ulcer. তাহলে আমি এতদিন খাচ্ছিলাম স্যার, কিছু হয়নি, যেই বন্ধ করলাম তাই স্যার আমার ইয়ে হয়ে গেল, আলসার হয়ে গেল। And it happens, it really happens. So this is your parietal cells and this is your HCl. In the HCl formation, H plus and Cl minus keep in the lumen, and pH in the lumen is more than 1.5 to 1.8 pH, and in the cell vicinity their pH will be little bit more, right, 3.5, because there is also this neutralizing the H plus ion by the bicarbonate ion, right, and this blood vessel is continuously releasing the bicarbonate, That is the important point of this alkaline tide. So if anybody say that what is the utility of this alkaline tide, so your answer will be like that. So due to this alkaline tide, the blood vessels having the bicarbonate, and then into the pits, it diffuses the bicarbonate into the next cells or surface epithelial cells to release the bicarbonate into the surface epithelium to protect the potentity of the H plus ion, so that cannot damage your surface. If still it is to damage, then your restitution stem will come, right? Stem cell will come. That also happens. So if it is hypersecretions, you are in stress, then it can come as a hypersecretion pattern will come. Now, this HCl, how it is controlled? Who is a controller of this HCl? Anyone? Who can control this? Who can control? So already you know that there are some 3 phases of our gastric secretions. Last page, yellow color. Bolo. What are the phases of our gastric secretions? How many phases are there? Raise your hand who those know. 1, 2, 3, 4, 5, 6, 7, and yes, last. No, last, ekdom last. Yes, phase, very good. Then anyone can say that what is the cephalic phase and how it acts? You. Sit down. Biphacus, how it comes? How it's happened? How it's happened before entering? Bolo, ke bolchil hath bolo. Yes, thinking, smelling, tasting. Then where it acts well? Where it is present? It is a medulla. So that is the term I want to hear this. There's a medulla part is there. There's a neuron. From there is a vagus nerve is coming and connected to our different parts of our stomach, right? Especially in the corpus or the body. Stomach er corpus ke body bola hoy, right? So this part is controlled by vagal nerve, right? Through which chemical neurotransmitter? It is acetylcholine. How it acts? It acts through a receptor. Any chemical, any hormone acts through receptor, right? Receptor means a protein is there, and that ligand will be like that acetylcholine. Here M3 receptor is important for your acetylcholine. Remember that. In our GI system, M3 receptors are important for your acetylcholine, right? So acetylcholine is one of the important part to control the H plus ion or HCl ion. Number 2, ke ache ebare? Number 2 ke ache? So whenever written in your exam, it is how can control your GI, always divide in like that. There is a neural control, hormonal control, and the chemical control. Now it is easy, right? So this is your neural control happens. Now it is hormonal control. Which hormone helps to gastrin? Very good. Remember one important part of this part is that only gastrin is our friend for the stomach. Ki bollam? Gastrin, only the hormone of all the GI hormones, are the friend of the stomach. That means what? It helps gastric motility, it helps your secretions H plus, and also growth of the trophic changes. That means mucosal growth also happens by the gastrin. তাহলে গ্যাস্ট্রিনের 3টি ইম্পর্টেন্ট ফাংশনস আমি এখনই বললাম। কি বললাম? It promotes the secretion of HCl, number 1. Number 2, it gastric motility, that means it increase the gastric emptying. আমি স্টমাকে খাবার নিয়ে আছি, বসে আছি, আমার যদি এমটিং না হয় তাহলে কি করে হবে? ফ্যাট খেয়ে বসে আছি, আচ্ছা করে মটন খেয়েছি, হ্যাঁ, স্টমাকে ফ্যাট কি করবে? কোনো কাজ নেই। তো হি মাস্ট বি গিভেন টেকেন ইনটু দ্য ডিওডেনাম লেভেল so that bile will come, pancreatic lipase will come, so the breakdown is essential. Now the third is trophic changes, that means trophical function. Trophic means হচ্ছে growth, right? Trophic, TROPHIC, trophic changes to the mucosal surface or mucosal gastric mucosa. The gastric mucosal গ্রোথটা আমার বাড়াচ্ছে হচ্ছে কে? Gastrin. Now the questions was taken that if anybody PPI is taking from 2 months, কে খাচ্ছিস 2 মাস ধরে টানা? কে খাচ্ছিস? Anyone? আর কেউ ভয় আর কেউ বলবে না, অনেকেই খায়। So don't bother about that. PPI is taking for 2 months. That means you are blocking our what? Proton pump. So HCl will be less, right? Now if HCl is less, then gastrin will be less or high? Gastrin will be high, right? So that is the negative. So gastrin will be high, and gastric এর একটা ফাংশন এখনই বললাম, that is a trophic function. That means it increases the growth of the all cells, including parietal cells. বোঝা যাচ্ছে? তাহলে number of cells of the parietal cell will be increased in throughout the 2 months. Now you stopped. Now you have stopped the PPI. PPI শুরু করার আগে যদি 4টে সেল ছিল প্যারাটাল সেল, এখন 400টা সেল হয়ে গেছে, তাহলে কোত্থেকে অ্যাসিড বেশি তৈরি হবে? 400টা সেল থেকে বেশি তৈরি হবে। তো দ্যাটস ওয়াই ইট ইজ কজিং রিবাউন্ড হাইপার সিক্রেশন অফ দ্য অ্যাসিডস, and that is not acceptable at all. So that's why when any patients or any relative, it's not my domain, because in pediatric practice we never prescribe the PPI for the 2 months, 15 days, etc. No, not required at all. If it comes, হ্যাঁ স্যার এটা খাই, কোনো ডাক্তারবাবু এটা দিয়েছেন, তাহলে আমরা কি করি? ডোন্ট স্টপ ইট দিস ওয়ান। যখনই এটা স্টপ করতে যাব তখন আমরা যেটা করি, উই ইউজ দ্য H2 ব্লকার। আই এম কামিং, হোয়াই ইট ইজ X। H2 ব্লকার মিনস এন্টেরোকোমাফিন, ইয়েস, হিস্টামিনকে আমি ব্লক করে দেবো। সো দ্যাটস ওয়াই যে অ্যাসিড সিক্রেশন যেটুকু হবে তাকে খানিকটা প্রিভেন্ট করতে পারা যায়। সো দিস ইজ ইয়োর, ইট ইজ ইয়োর ফিজিওলজিক্যাল মেডিসিনস ইজ কামিং, রাইট? সো দিস ওয়ান ইজ ইয়োর ফাংশনটা এখান থেকে এলো। বুঝতে পারছিস ক্লাসে কিভাবে পড়াশোনাটা যায়? গ্যাস্ট্রিন থেকে এতগুলো ফাংশন এলো, কারণ গ্যাস্ট্রিন কি করে না, HCl-কে বাড়ায়। সিম্পল জিনিস, HCl-কে ইনক্রিজ করে। কিভাবে করে আমি আসবো। নাম্বার 3 কে আছে? হিস্টামিন, রাইট? এটা হচ্ছে কেমিক্যাল, হিস্টামিন আছে, হ্যাঁ, কি কে হিস্টামিন। এখানে ভেসোডাটা নিয়ে কোনো কাজ নেই। নাম্বার 4 আরেকটা কে আছে? সোমাটোস্ট্যাটিন, যেটা ডি সেল থেকে বেরোয়। কোত্থেকে বেরোয়? ডি সেল থেকে বেরোয়। সোমাটোস্ট্যাটিন রিলিজ from the D cells, and D cell present in corpus as well as antrum, right? So antral D cell and antral G cell, antral G cell and antral D cell is involvement to control the HCl secretion from the parietal cell, right? তাহলে এদের মধ্যে এই যে উপরের 3টে এরা হচ্ছে স্টিমুলেটরি, আর সোমাটোস্ট্যাটিন, রিমেম্বার অলওয়েজ, it acts through GI, that means G inhibitory protein, right? So G coupled protein এর পরে যেটা GI, GQ, GS, তোরা যখন পড়বি তখন বুঝতে পারবি। So this is always inhibitory. সোমাটোস্ট্যাটিন ইজ সারা জীবন যা কিছু করে এসছে সবসময় ইনহিবিশন। যদি ইনহিবিটরি কিছু বলে, GI সিস্টেম রিলেটেড, সোমাটোস্ট্যাটিন বললে হবেই হবে। বোঝা যাচ্ছে? So these things are your stimulatory and this is your inhibitory for HCl secretions. বোঝা গেল? So this M3 receptor is present throughout our GI tract. ওটা জুড়ে থাকবে। কোথায় থাকে? মনে করো এটা প্যারাটাল সেল। প্যারাটাল সেলটা একটু হালকা করে দিই, অনেক কিছু হয়ে গেছে। প্যারাটাল সেল। তো প্যারাটাল সেলে যেটা আমার বেসাল রিজিয়ন, মানে যেটা ব্লাড ভেসেলের দিকে, সেইখানেতে কিছু রিসেপ্টার্স আছে। These are all the receptors are there in these areas. Receptors are there. Suppose this receptor is your M3 receptor. এইদিকে থাকবে না কিন্তু, receptor not apical part, this is only the basal part near the blood vessel. M3 receptor তাহলে এখানে করবে কাজ, বোঝা গেছে? অ্যাসিটাইলকোলিন will work here, কিভাবে করবে কাজ? For increasing the calcium. Acetylcholine functions করে to increase the calcium, and that's why ultimately it affects your potassium, sodium, hydrogen potassium pump. এই পাম্পটাকে সে স্টিমুলেট করে দিচ্ছে, বোঝা গেল? নাও গ্যাস্ট্রিন দুম করে এখানে চলে আসতে পারবে? কেন আসতে পারবে না? দিস ইজ হরমোন। সো নাও ইউ হ্যাভ টু আন্ডারস্ট্যান্ড হোয়াট ইজ অটোক্রিন, হোয়াট ইজ প্যারাক্রিন, অ্যান্ড হোয়াট ইজ এন্ডোক্রিন। অটোক্রিন মিনস হোয়াট? সেল থেকে বেরোলো, ওই সেলেই করলো কাজ। সেল থেকে বেরোলো, ওই সেলেই কাজ করলো। সো হোয়াট ইজ হ্যাপেনিং? সেল থেকে বেরিয়ে ওইখানে থেকেই করলো কাজ, ওইখানে তার রিসেপ্টর আছে। দিস ইজ কল্ড অটোক্রিন। অ্যানাদার ইজ টু সেলস আর নিয়ার বাই, এখান থেকে বেরোলো, এখানে রিসেপ্টর আছে, এখানে কাজ করলো, প্যারাক্রিন। এন্ডোক্রিন, একটা সেল থেকে বেরোলো, দেন কাম টু দ্য ব্লাড, আগে ব্লাডে যাবে, দেন ইট উইল কাম, দিস ইজ ইউর হরমোন, রাইট? এন্ডোক্রিন নেভার এভার, রিমেম্বার দ্যাট, এন্ডোক্রিন অ্যান্ড এক্সোক্রিন, রাইট? এক্সোক্রিনের ডাক্ট আছে, বাট I am telling both English and Bengali. If you follow, then you have to understand Bengali also. Yes, this is too fast, because this MBBS class is very short. Okay, you have to understand, otherwise you note down and go through your friends. Okay, in the meantime of my lecture you are stopping me, that means I am giving my lecture 50% off, right? Note down, it's যে স্যার আমি এটা বুঝতে পারিনি, and after your class you can ask me. Okay, so remember that always, because I am telling here not by remembering everything, right? I have no slide at all. I have no slide at all. Is very easy, এগুলো সব লিখে দিয়ে চলে যেতাম। How I can understand you that the PPI long term can happen due to the effect of trophic changes of the gastrin, and that can cause hypersecretion. It is not written in your any slide, right? It is practical experience I am saying you. So this is important that so this is your endocrine, this is autocrine, paracrine, endocrine, right? The three types of glands are there. So autocrines means what? Means it releases from the cell and it acts on the own cell having some receptor. Paracrine means it releases another cell A1 and acts on the cell 2 having some receptors. What is the endocrine? Endocrine always have to go into the blood. So gastrin is a hormone, so it must be come into the blood first, then it will enter into the parietal cell. There is a receptor, it is called CCK. CCK is a hormone. I am asking the name of this one, receptor, which is responsible for the gastrin action. So there is a M3 receptor for the acetylcholine, and for the gastrin there is a receptor that is called CCK2. That is called CCK2. Now this is your mind that gastrin কাজ করছে, but receptor name is CCK2. Why? Because gastrin and CCK enzyme is called the gastrin family hormones, right? So it's chemically, structurally is same for the CCK. তো CCK2 আছে মানে কোথাও একটা 1 আছে, বা in some journal it is written as a CCKB. CCKB also written. So don't confuse the 2 and B. CCK2 is present in the parietal cells, and CCK1 is present in the pancreas, acinus cell. That is actions of the CCK as a whole. That means cholecystokinin acts on CCK1 and gastrin acts on the CCK2, and CCK2 is present in this way. CCK2 is present in where? This is present in the parietal cell. CCK2 acts through our gastrin. This hormone means have to come after releasing from the G cell. এইখান থেকে মনে কর বেসের দিকে একটা G cell আছে, সেইখান থেকে গ্যাস্ট্রিন বেরিয়ে ওনাকে আগে ব্লাডে আসতে হবে. That will come into the blood and then it will come to react into your CCK2 at the parietal cell basal region, right? And then only it stimulates for the formation of H+ ion, right? Now this gastrin also indirectly release the HCl. Anyone? How it is possible? Indirectly. Indirectly, how it acts for the release of this one? How? Because this gastrin acts on enteroconfin cell, right? Stimulatory. This cell releases histamine, and that acts on parietal cell to release HCl. বোঝা গেল? তো ইনডিরেক্টলি কি হলো তো এটা ডাইরেক্টলি হলো না তো directly it acts on through the CCK2 receptor but indirectly it acts to stimulate the HCl secretions by stimulating the enteroconfin like cells that produce histamine and histamine acts on parietal. Now question is that sir histamine কোথায় কাজ করে? Yes, histamine comes into this receptor. এই রিসেপ্টরকে বলা হয় H2 receptor, right? এটাকে বলা হয় H2 receptor. Now you already know that PPI, that is proton pump inhibitor, inhibits the proton pump. That means hydrogen potassium ATPase pump. Now this H2 blocker is here. A H2 receptor is there. I already told you if anybody is continuing 2 months, 3 months, 4 months PPI, if any patients come to me or any relative come to me, I never say that stop this. Before stopping that, 1 week, 2 weeks, we'll continue to add that H2 blocker. That is ranitidine, famotidine. Hedges to naki tora alpo salpo, Femtag, Gintag, ache na? So that's are your H2 blocker. That is your H2 blocker acts here. And if it is H2 blocker, that means এইটা কাজ করতে পারছে না and সেইভাবে যতটা বাড়ানো যায় HCl secretion কম হবে. So gastrin acts indirectly by activating the ECL, that is enteroconfin like cell, and then it releases histamine. Histamine acts on the H2 receptor and this H2 receptor helps for the secretion of H plus ion or H plus CCl ion. This one done. Now these somatostatin receptors are there also, but it inhibits, right? So it inhibits the secretion of the HCl. How? Because this one is our GI related peptides দিয়ে কাজ করে তো যখন বায়োকেমিস্ট্রি পড়ি বুঝতে পারবি that's why somatostatin acts as a receptor name is SSTR, somatostatin receptor আর কিছুই না SSTR, somatostatin receptor, right? So in the parietal basal region we get the 4 types of receptors are there. One is M3, that acts acetylcholine acts on this, then the gastrin, the CCK2 and then H2, that is histamine, and the fourth one is your somatostatin receptor, that is SSTR receptors are there to inhibit. Eta kintu inhibition, that is causing the inhibitions of the HCl. So any somatostatin inhibits the any cell or any secretion inhibition hobe somatostatin always. So if it is written in your exam, questions come as how HCl secretion is controlled, then these 4 points is important to elaborate. And if you elaborate like this, a picture only, you will get also full marks. That's you are giving the receptor name, you are giving how it acts, then only you can get the full marks. So here it's important to understand the parietal cell basically in a cellular structure, right? Parietal cell একটা এঁকে আজকেই কিভাবে HCl বেরোলো সেটাকে ইয়ে করা আরেকবার লেখা। সেকেন্ড, হাউ ইট ইজ কন্ট্রোল, রিসেপ্টরগুলোকে এঁকে একটু স্টার্ট করে দেওয়া। এই 4খানা রিসেপ্টর অনলি, আরও রিসেপ্টর আছে, আই এম নট গোয়িং ডিটেলস, but it is important for your clinical applications. So nowadays, whenever your family members is taking any ranitidine, famotidine, omeprazole, etc., you will keep in mind that will works in the parietal. Oh, that's why the hydrogen potassium ATPase pump is blocking. So you can advise in your family members, in your friends, those are taking the PPIs regularly, randomly, taking like that 10 দিন খেলাম, 15 দিন খেলাম, 20 দিন খেলাম. So you can say that এটা এইভাবে খাওয়া উচিত নয়। কেন উচিত নয়? Because of that, if it is HCl H plus ion is a directly inhibitor of the gastrin. If HCl is less, then gastrin will be high. Now gastrin এর third functionটা কি ছিল? Trophic function. What does it mean? It means the proliferation or increasing the number of cells. That means what? That parietal cells number increase. So তুমি তো থামিয়ে দিলে, থেমে গেল, এবার বন্ধ করে দিলে, কি করলে? নাম্বার অফ প্যারাটাল সেল ইনক্রিজ করে গেছে। তাহলে এই একটা প্যারাটাল সেল থেকে যদি HCl বেরোয় মনে কর 1 লিটার, তাহলে যদি 400 হয় তাহলে কত বেরোবে? সিম্পল জিনিস। So huge amount of HCl will come and hypersecretion come, and that can cause as a gastric perforation also. So that is the side effect. So remember that medicine is a drug. So whenever applicable, which dose and which indication is it important. এমন নয় যে আমি ওষুধটা জানি দিয়ে দিই, আমি ড্যান্স করতে পারলাম না, আমি দিয়ে দিলাম. So that may hamper in your total physiological system will be damaged. So this is your total overall HCL secretions, and it is controlled by the four things only, that is your acetylcholine coming from your vagus nerve. And vagus nerve, you already know that when the food in your stomach, then it is called gastric phase. Gastric phase happen, two important findings were there. One is local reactive reflex, means submucosal reflexes are there. For that only acetylcholine is coming out. And again, there is a big reflex there. What are those? Vagovagal reflex. Vagus diye jabe, that will come again into big arch. It is a big reflex. So vagovagal reflex, as they come as a short note, then you can say that is a control of our gastric phase is important. Not only that, in the gastric phase, our gastrin is released. Your gastrin is released also. Gastrin ke release korte gele, this is endocrine type, so that means it comes into the blood first. Any hormone not go directly into the cell to act. It must have to go through our blood vessels. It is essential. And if it is in autocrine fashions, there are lots of physiology chapters are there where cells will come, then same cell কাজ করবে. So that is your autocrine. So these three terms is a physiological term. There is autocrine, paracrine, endocrine is important. Exocrine gland and endocrine gland, only difference is ducts. Right? Endocrine kono duct থাকে না. So that's why it must be connected to the blood vessel. Right? Exocrine gland, that is a pancreatic is exocrine gland, salivary exocrine gland. So that has the duct. Right? So duct যেখানে আছে সেটা exocrine gland, যেখানে duct নেই সেটা হচ্ছে endocrine gland. So this is very important. As a medical student, you have to understand these things. Now you know, if suppose time ही नहीं, so I am getting almost 10 minutes every day. So that is your bad luck. Anyway, I will try my best. Suppose a patient come with recurrent ulcer, peptic ulcer, right? Recurrent, বারবার হচ্ছে. On endoscopy, what do you mean by endoscopy? Means একটা নল আছে, endoscopy দিয়ে ভিতরে আমি ক্যামেরা নিয়ে দেখতে পারি. কি দেখবো? দেখলাম multiple ulcers are there. Multiple ulcers in stomach as well as intestine. In stomach, intestine, presented with vomiting, anemia, right? And you can say the bloody stool or black color stool, you can say. And then also hematemesis. What do you mean by hematemesis? Vomiting. Blood vomiting is coming. Hematemesis. Just remember not to memorize everything. I am dealing such type of patients, recurrent multiple ulcer, and not recovered by common drugs like PPI, H2 blocker, bhalo hocche na, right? Even remember that one bacteria can cause our ulcer. Anyone? Helicobacter pylori. So nowadays ulcer is called an inflammatory disorder, right? So there is a chapter in your pathology. You can go through this one if you want to be a good clinician. That is inflammation. If I understand properly the inflammation chapter, that means in outside keeping in your OPDs, you are the boss. Because all the things are itis, hepatitis, pancreatitis. So itis means inflammations. So this inflammation chapter, you thoroughly go through this. If you don't understand, mark it, what is happening here. If you understand inflammations, huge chapters are there, lots of books are there, but still in pathology is given. Inflammations, যদি আমরা ভালো করে বুঝতে পারি, that will create a very good impressions in all throughout your MBBS classes, like physiology, microbiology, pharmacology, medicines, pathology, everywhere you can be benefited. So all the time I said that only the 2 to 5 students only can go through this, because your anatomy patient is there, biochemistry patient is there, so lots of patients. The information only the chapter that you can go through this with your time, one page, half page per day. That's also enough, right? So anything, any H. pylori bacteria কে আমি ইরাডিকেট করেছি এই পেশেন্টের ক্ষেত্রে তাতেও ভালো হয়নি। দ্যাট মিনস এইচপি কিট পাওয়া যায়, রাইট? ইফ ইউ সাসপেক্ট, দ্যাট ইজ এ বায়োপসি, দ্যাট ইজ এ টেস্ট ইজ বায়োপসি ইজ দেয়ার, H. pylori biopsy ক্যান বি ডান, the gastric mucosa থেকে নিয়ে আমরা you can get the H. pylori and H. pylori kit is there, is very treatable case in pediatrics also. H. pylori I get around 6-month interval, I can came across one patient with peptic ulcer having the H. pylori. That's not so uncommon. So now this patient is coming recurrent, having the treatment, all the things, all treatment happens but not curable at all. Then what do you think? Then only the thing is that the patient's having some tumor in the islet cells of pancreas. This is called your gastrinoma. This is called your gastrinoma. Now remember, this নামের মধ্যে কি লেখা আছে? The gastrin neoma. Oma means কি? Tumor, not cancer. Oma means tumor. So gastrinoma, that means is releasing so much gastrin. But you know that the gastrin release only the two sides. One is antrum and another is upper part of the duodenum. One is G37, H34 and this G17. Remember that I escaped in the previous class, I thought that I remember যে তোদের block হয়ে যাবে, 14, 17 both are coming from our antral D cells and G cell 17, that is G17, that means gastrin 17, only the maximum helpful or potential to release the HCl, not the 34, too much, extend অল্প করে. So now, so another site you got, if any islet cell tumor. So if a broad classification as there is a islet cell tumor. I am telling 1 to 3 parts. That is the one is gastrinoma, insulinoma, glucagonoma. সব হরমোনের নামগুলো চিন্তা করো। ইনসুলিনোমা, রাইট? গ্লুকাগোনোমা, গ্যাস্ট্রিনোমা, ভাইপোমা। What do you mean by ভাইপোমা? VIP, আমি আসবো, GI hormone, vasoactive intestinal polypeptides, right? So this is your tumors and this is your OMA, means tumor is happening. So if any patients come with recurrent multiple ulcer, normal ulcer is single or multiple না হয় না, এবং multiple sites are there involvement, all treatments given, now blood is coming out, so always think about some tumor in the pancreatic and releasing the gastrin so much, right? So now the topic is come as a gastrin. So gastrin, how it is controlled? Anyone can any idea how it is controlled and how it is formed and how it is acts totally into the your stomach? Any idea of that? Amar time কত আছে? নেই almost. So gastrin cells are there, G cells are there, right? G cells কিরকম দেখতে হয়? Write that. Finger like projections are there. Nucleus is there. This is our gastrin cells. That means G cells are there. এইখান থেকে আমাদের বের হচ্ছে কি না gastrin, right? So when we eat, so any activates this one. It is a lumen, right? This is a lumen. So there are some receptors are there. There are some receptors are there. There are some receptors are there. What are those? One is receptor for amino acid, one for amino acid, one for peptides, right? Another for your H plus ion, another for your somatostatin, right? So receptors now is present in the apical part. বোঝা যাচ্ছে চেঞ্জ গুলো? So these things are happening. So when you are taking any food, so partially digested amino acid, peptides will activate these receptors, and if it activates, then it will form the gastrin. If gastrin is calm, then directly it will act or not. It will come into কোথায়? Blood vessel. Blood vessel থেকে যেতেই হবে. So this one come as a stimulatory, peptides, amino acids. Another, suppose this is your blood vessels. এখানে তুই খুব স্ট্রেসে আছিস, সামনে এক্সাম আছে, তোর পেটে খুব জন্য ব্যথা হচ্ছে। How it happens? Because of release of your gastrin. Because whenever you stress, epinephrine will release. What release? Epinephrine, sympathetic stimulations, right? And also calcium. Also calcium. So calcium and epinephrine also stimulates our G cells to release our gastrin. So stimulatory এখানে কে হলো? অ্যামাইনো অ্যাসিড হলো, পেপটাইডস হলো, এপিনেফ্রিন হলো, আর কি হলো? ক্যালসিয়াম হলো, রাইট? নাও this is your H plus, which is inhibitory. Whenever H plus is increased, it's causing the inhibitions. It causing the inhibition of the G cells to release that. Say explanation আবার, যদি HCl কে কমিয়ে দিলাম, যদি HCl কমিয়ে দিই, যদি H plus আর না থাকে, তাহলে এই ইনহিবিশনটা চলে যাচ্ছে। তাহলে এটা বাড়তেই থাকবে গ্যাস্ট্রিন, গ্যাস্ট্রিন যদি বাড়তে থাকে তাহলে টপিক চেঞ্জেস করবে, প্যারাটাল সেলের অ্যামাউন্ট বাড়াবে, নাম্বার অফ প্যারাটাল সেলস উইল ইনক্রিজ। So that's a hypersecretion. So H plus is a directly inhibitory. D cell, that is a somatostatin, again inhibitory. And also vagal stimulation also stimulatory. That is called M3 receptor. No, that is not M3 receptor. That is called gastrin-releasing peptide receptor or gastrin-related peptide receptor. বোঝা যাচ্ছে? এইখানেতে যে ভেগাস নার্ভ থেকে যেটা রিলিজ হবে, that is not our acetylcholine. That is called gastrin-releasing peptides or gastrin-related peptides, and that is receptor name also like that. So remember, that is a exception as there. Vagus nerve is a parasympathetic nerve, always produces acetylcholine, right? No problem, you will run that. But in case of gastrin, that releases the gastrin-related peptides, and that acts on that receptor for the stimulation of the gastric gas. তাহলে গ্যাস্ট্রিক আমাদের জি সেলকে কে স্টিমুলেট করলো এখনো পর্যন্ত? Yes, peptic, partially peptide বা peptides, then epinephrine, calcium and your GRP, right? These are stimulatory, inhibitory কে H plus ion and somatostatin, right? এইটুকু মনে রাখতে পারলেই অনেক, right? So I am thanking you so all. So here listenings, I have to complete this because time is time.